If you've started noticing some changes in your loved one, maybe they're repeating the same question over and over again, or maybe things are confusing them that should otherwise be familiar to them. And you're kind of wondering, what's happening here? Are we dealing with memory loss? Are we dealing with dementia? Are we dealing with old age? Should I see a doctor about this? Well, I want you to know a couple of things. The first is that what you're feeling and what you're wondering is actually normal. And secondly, I want you to know what could actually take place in the appointment with their doctor. Taking your parent for a cognitive evaluation can be a really emotional thing. I know this because I've worked with several of my clients who it's taken weeks to months to get them to actually just make the appointment for their loved one. It really takes a toll on you and you really kind of question yourself. But I want you to know that doing this and finding out exactly what is happening cognitively with your loved one is a really loving thing to do. You're being an advocate for them and they can't advocate for themselves. I've been in your shoes with my mother. I know how difficult it was to see the changes that she was going through and wondering, is it just old age and forgetfulness, or are we looking at something more serious? I mean, her mother was diagnosed with Alzheimer's, and I knew the chances were really high, but I didn't know what to find out. I didn't know where to go. And to be honest with you, there was a part of me that didn't even know that I wanted to find out. But one thing I did want is I wished I had somebody to talk to say, this is what's going to happen. This is what you're going to do. These are the questions that are going to be asked. This is how it's going to go down. And I didn't have that. But I want this video to be that for you, right? So I am here to share some of this information with you to hopefully make this emotional decision a little bit easier for you. So here's something that many new caregivers really don't realize, that you are actually a critical part in the diagnostic process. You're not a bystander, you're actually a source. And most of the time, identifying these changes in our loved ones, it doesn't come from a doctor or a specialist. It comes from you, the family member who has been around, and you know what your loved one is, quote unquote, normally like, and the changes that you've been seeing, right? You know about the repeated questions or the same story told over and over again in the same conversation, right? That it just starts and stops and starts all over again, right? You know that. You can see the confusion about finances, right? The checkbook that doesn't add up, or the checkbook that doesn't show up because it's been missing, right? It's lost somewhere. Getting lost in a neighborhood that your loved one is driven through for 30 years and suddenly they're not quite sure which way to turn. Medication that goes missing. They lost the bottle. They think they took it. They don't think they've ever taken it before. And even just those subtle personality shifts, right? You might not be able to exactly put your finger on it, but you know that something is definitely different. Maybe they're a little more agitated, a little bit more aggressive. Maybe they're defending themselves much more, almost like the preemptive strike to you saying, no, that's not right. Whatever it is, and you can't quite put your finger on it, these could all be clues and signals that this evaluation really is kind of needed. And so what I want you to know is that your observations actually are really very important. And if you're sitting there right now thinking, well, what if I'm wrong? What if I'm not really seeing these things? What if I'm overreacting? I want you to know that in all my years of working with caregivers, nobody has actually regretted advocating for their loved one to learn more, to learn how they can help their loved one better. Okay, so you get to the appointment, and your first question should probably be, what are they going to test for? And what does the test look like? Well, they're most likely going to be doing some type of cognitive screening test. Think of it as just, like a little snapshot, a way to, get a baseline, just a basic about how your parent's brain is working. And one of the most common one is called the MMSE test. It is the mini mental state examination. And it doesn't take more than like 10 minutes. And so the doctor might ask your parent, what day it is, what city that they're living in. They might ask them to remember 3 simple words. And then later in the conversation, in the examination, they'll ask them to repeat those words back to them. They might ask them to count backwards from 100, but do it by 7, which would make me think, because math wasn't really my big thing. And they might ask them to copy a simple drawing. So it's short, it's quick, but it is something that can kind of give them this baseline to track exactly what the functioning is of your parent's brain. They might also, do another test that is called the Montreal Cognitive Assessment. And this one goes a little bit deeper. It includes a drawing of a clock. You might have heard that before about the drawing of a clock to determine if a person has dementia. It might also include naming animals when they're shown a picture, if they can name those animals, and maybe even repeating sentences back to the doctor or the person who is giving the exams. This one sometimes is used so that they could see some changes that they can catch earlier in earlier stages of cognitive decline. And there's also a brief test that is called the Mini-Cog. And this is just 3 to 5 minutes. Your loved one would be asked to remember 3 words, repeat them back later, draw a simple clock. And what's useful is about it that it is less influenced about any kind of educational background that your loved one might have. It's really just, very straightforward. And they can, again, like I said, get some baseline information. You might also have heard of the SLUMS exam. This is the St. Louis University Mental State Exam. And it's similar to the MMSE, but sometimes clinicians or doctors prefer it because it too can catch some subtle things just a bit earlier, right? Which is good. So I just want to stop here for a moment and say something that I really want you to understand. These tests are not a verdict. So if your loved one gets a poor score, it doesn't necessarily mean they definitely have dementia. And the same thing is if they get a really good score, it doesn't necessarily mean that they don't have or won't have dementia in the future. The very earliest stages can be very difficult to identify. So, these testings can give a real clear baseline picture that can be followed up in the future. And that is a really good thing. So that clock drawing test that we talked about, it sounds almost too simple to, simply draw a face of a clock. But when your loved one is asked to put the numbers on the clock and set the hands to a specific time, it really can reveal a lot about what is going on inside our loved one's brain, right? It shows how the brain plans things, how they organize things, how they process things. And, that whole spatial interpretation is really important. And it shows that executive functioning that the doctors might be looking for. So that very simple test really can tell a lot. And it tells also how to put things in a sequence, right? That sequential plan. And those are some of the things that start to be affected early on in dementia. And sometimes, if the situation is a bit more complex, your doctor might actually request a more complex test, something that is called a neuropsychological evaluation. And this is an evaluation that takes a bit more time. It could actually be several hours. And what it tests for is it tests for language, it tests for attention, reasoning, it tests for their processing and their processing speed as they are trying to solve problems. And interestingly enough, this test can actually test mood. And that's actually really important because situations such as depression can actually mimic dementia, especially with that forgetfulness and that moodiness. And so if they can test for that and find out if really it is more of a depression kind of thing, then medications can come into play and it can actually be treated. So the goal of this kind of evaluation is really to differentiate between what is dementia, what is depression, what is stress, how about medications? Could that be affecting their thought processes and their decision making? And, could it be just normal aging? And that's what this is all about, right? Getting that clarity on what is exactly going on so that you can create a path that moves forward productively for your loved one. So if you're finding this helpful with these practical tips and this really step-by-step kind of thing, I invite you to subscribe so that you can be notified when I upload more videos similar to this that really gets just to the center of what is happening, right? That's what I want for you. You as a caregiver don't have all the time in the world. I want to be able to share concrete, practical information with you that can make your job easier. So the next question that you should be considering to ask your doctor is, what other types of evaluations are going on aside from these cognitive evaluations to figure out what is happening with my loved one? Because the cognitive evaluation, this test, doesn't really work in isolation. There are other things, other physical things that the doctor might need to be looking at. And one of those is actually the blood work, right? They can check to see if there is vitamin deficiency, if there's some kind of thyroid problem going on, which really can send some things out of whack, especially our hormones. Maybe there's an underlying infection going on. It is without a doubt, if an older person has a UTI, it makes them appear as if they have dementia, and they don't always feel that pain that we would at a younger age, and they might fall more often, they might get confused more often, and it comes with that type of infection. So they'll be looking at blood work for that type of things. They might also do some brain imaging, like a CAT scan or an MRI. I can say that one of the first clues, aside from the confusion and things I was seeing with my mother, but she had fallen at one point, and I did get the results of the CAT scan, and in it was noted the shrinking of the brain, right, which is one of the things that happens with dementia. Also, just looking at her medications and reviewing those drugs and the interactions, right? You don't know what those interactions can be. And, sometimes one specialist prescribes one thing and another specialist prescribes another, and they don't necessarily talk back and forth. So that could be something that sort of throws off your loved one. And another thing I want to mention here, talking about medication, is I had a real issue when my mother lost a lot of weight as the stress got really heavy with my father passing of lung cancer. And because she lost a significant amount of weight, those medications she was taking were actually too powerful for her. And we had to actually go into some of her specialists and say, we need to rethink this. Look at her weight. And once they made that adjustment, things got better. So just throwing that out there as a public service announcement that nobody told me about, and we just kind of figured it out on our own. So another thing, of course, is just some basic functional assessment of day-to-day life. And this is where you come in as being really important. How is your loved one cooking? How are they taking care of the finances? Are they able to keep up with taking their medications on time? How are they doing with driving? And your doctor doesn't know any of that. And your loved one can say whatever, right? But you're the important key point here. So make sure you have your notes and you'll be able to go back and look at them. And if you feel uncomfortable talking in front of your loved one, you're allowed to ask to talk in the hallway or to talk before the appointment or to talk after the appointment. That would be fine. Ask them what they could do. So, your doctor's going to put all of this information together, and it's kind of complex and it could take a while for them to get the full picture. So you might not walk out of the doctor's office that day with a particular definitive answer, with a particular diagnosis, or no diagnosis, right? Depending on whatever it might be. So that waiting time until you get that information back, I know can be stressful, right? It can be struggling. And even for your loved one, if you've had the conversation and they understand while they're there, they too might want, some answers. So I do want you to know that before you leave that doctor's appointment or anytime during it, you do have the ability to ask specific questions. Please don't ever walk out of a doctor's appointment and think, well, I don't know, they never told me. You're the one that can ask. You're the one that can stop them and ask to repeat things. It's important, and they will do that for you. So don't ever feel intimidated. Actually, be the opposite. I know that I always showed up at the doctor's office as if they were a used car salesman. Like you have to, I really always felt like you have to convince me that what you're saying is right. I want you to give me all the facts. Don't just give me a diagnosis, but give me the reasons. And then I would write them all down. I kept a notebook for both my parents, writing them all down. And then I would go home and I would do my own assessment too, right? We can do that. They're not smarter than us. They just collect different information than we do. And it's fine to ask them to repeat and to explain. It's definitely nothing that makes you seem, less intelligent. If anything, it makes you seem more intelligent because they can tell you're really trying to problem solve. So in just, adding on to that, your last question might be, how do I prepare for this? And again, I encourage you to write your questions down that you have right now before you get there. I encourage you to write down the evidence, right? What are the things that you are seeing? You can write down that, recently in the last couple of months, she's been repeating herself through conversations, telling the same story over and over again. You could say, at Christmas, she forgot the names of her own children. You can say that, your father is asking about relatives that have passed on. Keep a list of those things. I remember when I first mentioned something to my mother's general practitioner, it was right after my father had passed and she had already had a regular appointment. And she had been talking about being confused about things. There was a tremendous amount of stress with the passing of my father with lung cancer and the time that led up to it, those last few months. And I kind of thought, well, strike while the iron's hot because she's talking about it. And so I brought it up to her general practitioner. And unfortunately, he just kind of brushed it off to grief and said, well, of course, she's a bit different. She's a bit confused. She's just lost her husband. She's grieving. And I didn't have anything specific to share with him. So I didn't say anything. And it got brushed off and we just went about our business. but I want you to be prepared. You're going there specifically for this diagnosis, or at least this conversation about what the next steps should be. So come prepared. Don't feel that writing the things down is silly or awkward or inappropriate. Actually, you're the best source. And the doctor, if they're a good doctor, are going to want to know specifics, right? They're never going to be able to replicate the situation that you saw things in. So your information is really very valuable. And I really want you to know that, right? I want you to know how important it is. Also, you want to prepare by bringing with you the list of medications and the dosages. So write those down. You can oftentimes get your general practitioner to print those out. Sometimes they print them out after you leave an appointment. So you can just, find one of the summaries and print it out. And, you get to consider whether or not you want to go in to the doctor's appointment with your loved one. You can be there not to talk over them, not to answer for them, but you can be there to be a good listener, because the chances are very, very high that your loved one is not going to remember what happened. So you can actually watch and observe for yourself. But also, you are a key partner in this observation of what you've been seeing happen. And you can go in with your notes, right? So, you don't have to talk a whole lot to your loved one before you go to this type of appointment. Each one of us knows our loved ones best. With my mother, if I talked too much, then she would do the opposite from what was asked of her. She'd say the sky was purple instead of blue, just because that's how her dementia was working. She was back to that spiteful child kind of thing. So, you assess and fill out your loved one for yourself, what stage they're in, if they're inquisitive themselves and curious and wondering, or you can just make it another doctor's visit and they just happen to ask these different questions and do these different tests. Your loved one might not even perceive it as a test. They might perceive it as conversation. Only you can determine that. So my friends, I know that this is not an easy conversation. And I know that as soon as you start wondering for yourself, does my loved one have dementia? Things start to feel heavy. They start to feel real. They start to feel like, well, now what? What's going to happen next? How am I going to handle this? How am I going to take care of this? I want to reassure you that having the knowledge from your doctor is actually powerful, because just sitting in all of the what ifs can cause our minds to spiral out of control and make things worse than what they really are. But hearing the results from the doctor can help you set a path that can help both you and your loved one. So if you have already had these doctor's appointments, or you're planning these doctor's appointments, I encourage you to go back into my videos and to check out the care plan, the care circle, and why it will help you and your loved one as you plan for the future for your loved one. All right. You are welcome to check out all of my other videos as well. And even more so, once you get a diagnosis, if that's the way this is headed, I am always available to speak personally with you as a coach for family caregivers. And down in my description of this video, you'll see a link that will take you right to a meeting with me, and we can chat. We can get to know each other. You can decide if I am somebody who you could work with and provide you the advice to quite literally walk with you on this journey of caregiving for your parent. Thanks so much for tuning in. Please know I'm always here for you. No one should have to walk this journey alone.